Data shows nearly 700 kids with the most severe mental health needs were stuck in emergency departments across the state at various times in the last year because of a chronic shortage of pediatric treatment beds and services.
Parents, mental health advocates, hospital officials, and physicians have started meeting weekly to address the crisis. One plan is to build a long-term pediatric residential treatment facility. It would be the first in Maine where kids can get the care they need 24/7. News Center Maine's Vivian Lee has the latest in this report.
The demand for treatment for Maine's most vulnerable kids is putting more strain on an increasingly fragile system.
We are seeing right now an increase in the number of children with developmental disabilities who are landing in our emergency departments.
Katie Harris is the chief government officer for Maine Health. She says 259 children were stuck in Maine Health emergency departments from January to May of this year for more than 48 hours. The average stay is 4.5 days, with the longest being around 2 months. Maine has lost 152 beds in programs that treat children with mental health problems and intellectual and developmental disabilities over the past 5 years. The latest came this summer when Spurwink closed 3 residential treatment programs, leaving only 2 programs in the state that take Maine care.
I would get called at least once or twice a week to come pick him up from school because it was to the point where they couldn't handle him.
Jessica Reed's 11-year-old son is on the autism spectrum. Brody is nonverbal and has severe behavioral needs and other challenges. He spent nearly a year on a waiting list for a bed at Spring Harbor Hospital, but his family cared for him at home while he was waiting rather than have him languish in the ER.
They are not equipped at all to deal with the very high crisis point that these kids are going through.
They don't want these kids to just be stuck in their ER with nowhere to go and nothing to do, and they feel bad, and it causes burnout and it causes moral injury.
Dr. Andrew Earhart is an emergency room doctor and the president of the Maine American College of Emergency Physicians, which represents more than 200 physicians across the state. He, along with parents, mental health advocates, physicians, hospital administrators, disability rights advocates, and DHHS officials, are meeting weekly to address the crisis. Under a law passed by lawmakers earlier this year, the group is tasked with making recommendations, including setting a timeline for establishing the first secure children's psychiatric residential treatment facility and other strategies to provide more outpatient services. It's also a significant step towards stopping the flow of dozens of children being sent to treatment facilities outside of Maine, including as far away as Arizona. A final report and recommendations must be submitted to the Joint Standing Committee of the Legislature by November 6th. Vivian Lee, News Center, Maine.